Have you ever woken up in the middle of the night, or even during a stressful day, feeling a peculiar chill despite being covered in sweat? Your skin feels clammy and cold, almost damp, yet you're not hot, and you certainly haven't just run a marathon. This unsettling experience, often called anxiety cold sweats, is a perplexing physiological response that many people encounter, yet few truly understand. It's a phenomenon that sits at a fascinating, sometimes frustrating, intersection of our mental and physical health. Today, we're going to demystify anxiety cold sweats, exploring why they happen, what they mean, and most importantly, what steps you can take to find relief and better manage them. Act 1. The setup. The paradox of the cold sweat. To truly grasp anxiety cold sweats, we first need to understand what differentiates them from typical sweating. When you exercise vigorously or spend time in a hot environment, your body sweats to cool down. That's thermoregulatory sweating. But cold sweats? They're entirely different. Here, your skin feels cool, perhaps even chilly, despite the perspiration. If this happens while you're asleep, it's often referred to as night sweats, and it's not because your bedroom is too warm. This specific type of sweating is fundamentally linked to your body's primal stress response, often known as the fight or flight mechanism. The paradox of feeling cold while sweating can be incredibly confusing and even frightening, making us wonder if something serious is going on. And while it can be a sign of deeper anxiety, it's also important to consider other possibilities, which we'll discuss shortly. This topic resonates with so many because of its puzzling nature and the significant impact it can have on daily life, prompting countless individuals to seek answers and support. Act 2. The confrontation. Unpacking the why and what else. So, why do our bodies react this way when anxiety takes hold? The key lies in our ancient fight or flight response. Imagine your body has an internal alarm system designed to protect you from danger. When you perceive a threat, whether it's a tiger in the jungle or a looming deadline at work, this alarm goes off. What happens next is a rapid-fire cascade of events. Your brain signals the release of stress hormones, primarily adrenaline and cortisol. These powerful hormones activate your sympathetic nervous system, essentially putting your body on high alert. Your heart rate speeds up, your breathing quickens, and your metabolism gets a boost, all in preparation for intense physical activity, like running away or standing your ground. As part of this preparation, your sweat glands are activated, anticipating the heat that would be generated by such exertion. Now, here's where the cold sensation comes in. In a real danger scenario, you'd be moving, generating heat. But when the perceived threat is internal, like anxiety, that physical exertion often doesn't happen, so you start to perspire without the accompanying heat buildup. This perspiration then rapidly cools your skin. Compounding this, the stress response also redirects blood flow away from your skin and towards your vital organs and large muscles, a process called vasoconstriction. With less warm blood flowing just beneath the surface, your skin temperature drops, contributing to that characteristic clammy and cold feeling. It's your body preparing for a battle that isn't physically fought. Cold sweats are a common companion to various anxiety-related conditions. If you experience them, you might also find yourself dealing with generalized anxiety disorder, panic attacks, social anxiety, or even post-traumatic stress disorder. They can also appear during intense nightmares. These sweats rarely come alone. They're often accompanied by other physical symptoms, such as a racing heart, hyperventilation or rapid breathing, trembling, a pervasive sense of fatigue, difficulty concentrating, sleep disturbances, an upset stomach, muscle tension, and a dry mouth. Recognizing these clusters of symptoms can be a crucial step in understanding what your body is trying to tell you. However, and this is a critical point, while anxiety is a frequent culprit, cold sweats are not always caused by it. It's absolutely vital to understand that this symptom can also be a signal of other, potentially serious, underlying medical conditions unrelated to anxiety. This is why a thorough medical evaluation by a healthcare professional is always the very first step. For instance, cold sweats can indicate shock from an injury or accident, a cardiac event like a heart attack, infections such as the flu, COVID-19, or sepsis, hypoglycemia, or dangerously low blood sugar, hypoxia, which is a lack of oxygen, menopause or perimenopause, where hot flashes and night sweats are common, side effects from certain medications, including some antidepressants, opioids, or hormone therapies, severe pain, like that from migraines, hypotension or low blood pressure, or even a condition called hyperhidrosis, which is excessive sweating itself. So if you're experiencing cold sweats, please don't self-diagnose. Consulting a doctor to rule out these other causes is paramount before focusing solely on anxiety as the root. This is one of the biggest challenges healthcare providers face, as the public often wonders, when should I see a doctor for this? The answer is always, if it's new, persistent, or concerning. The experience of cold sweats isn't just physically uncomfortable, it can also be profoundly embarrassing. This discomfort and self-consciousness can create a detrimental feedback loop. The physical symptom of sweating itself intensifies anxiety, which then, of course, leads to more sweating. This vicious cycle can significantly disrupt daily activities, social interactions, and especially sleep quality, leaving you feeling exhausted and even more anxious. Breaking this cycle becomes a key part of managing the symptom. Act 3. The resolution. What helps and moving forward. Now that we understand the why and the what else, let's turn our attention to what helps. The good news is, once other medical conditions are ruled out, there are many effective strategies for managing anxiety cold sweats. First and foremost, as we've discussed, always begin with a medical checkup. Your doctor can perform tests, review your medications, and ensure there isn't an underlying physical health issue contributing to your symptoms. This provides peace of mind and directs you towards the most appropriate course of action. Once anxiety is identified as the cause, a holistic approach is often most effective, focusing on both the root cause of the anxiety and the immediate symptom. To address the root causes of anxiety, lifestyle adjustments, simple, consistent changes can make a big difference. Incorporate regular physical activity into your routine, even just a daily walk. Prioritize a balanced diet, limiting processed foods and sugary drinks. Crucially, establish good sleep hygiene, aim for consistent bedtimes and wake times, and create a relaxing pre-sleep routine. Mind-body techniques. Practices like deep breathing exercises, mindfulness meditation, and progressive muscle relaxation can help calm your nervous system. These techniques teach you to consciously slow down your body's alarm response. Limiting stimulants. Be mindful of your intake of caffeine and alcohol. Both can exacerbate anxiety symptoms and disrupt sleep, making cold sweats more likely.
Professional support. Don't hesitate to seek help from a mental health professional. Therapies like cognitive behavioral therapy, CBT, or exposure therapy can equip you with powerful tools to reframe anxious thoughts and gradually reduce your body's stress response. In some cases, medication, prescribed and monitored by a doctor, can also be a valuable part of a comprehensive treatment plan. For managing the immediate discomfort of cold sweats, cooling down. If you feel an episode coming on or wake up sweating, try to cool your body. A cool shower, removing layers of clothing, or using a fan can provide quick relief. Hydration. Sweating can lead to dehydration, so ensure you're drinking enough water throughout the day. Appropriate clothing. Wear loose-fitting, breathable fabrics, especially to bed. Understanding anxiety cold sweats is the first powerful step towards regaining control. It helps demystify a bewilderment you to respond effectively. Remember, your body's fight or flight response is a natural, albeit sometimes overactive, protective mechanism. By recognizing its signals, addressing the underlying anxiety, and seeking appropriate professional guidance, you can interrupt that uncomfortable feedback loop and move towards a greater sense of calm and well-being. You are not alone in this experience, and there is help available. Take that first step towards understanding, and you're already on your way to feeling better.